Well, welcome, Chelley, to the podcast. We're so grateful to have you on. We typically start with some rapid fire questions, which I have here, and then I'll let you introduce yourself and all of that. But number one would be, what is a fun fact that would surprise your patients or your colleagues about you?
Let's see. Oh, that's a hard one. I, in my spare time, which I don't have very much, I like to write fan fiction.
Oh, that's awesome. I have zero writing abilities, so that's really cool.
Well, I don't have a lot of time, so it's
Yeah,
like kind of a dying art. Who knows if I'm even good at it anymore? So,
I know. Things are so busy nowadays. I totally get that. Second question would be, what would be your caffeine drink of choice? Let's say you just said you're really busy, so you're having a super long day, super long shift. What is your caffeine drink of choice?
yeah. So I don't consume sugar on a normal basis. So I
Okay.
drink unsweet tea, and I probably drink about like 40 to 60 ounces a day, and then the rest is water. I try to like keep
Okay.
it healthy because
Yeah.
a sedentary job, like
Mm-hmm.
being in front of the computer, it's not like when I used to work in the emergency room and was running around for 12
Yes.
hours a day.
Yeah, I totally get that. I got a walking pad for my desk because I was like, I need to be moving. I just find myself sitting for so many hours and I
Yeah,
have to be moving.
absolutely. Now, if you'd asked me 10 years ago, it was like 3 shots of espresso mixed into something really sugary. But the
Yeah.
older I get, oh, that's another fun fact. You know, I'm one of the oldest people at Clinic.
Really?
I am.
No.
And tomorrow's my birthday, so like another
Oh,
year wiser. But I know that this face doesn't look like it, but I'm
yeah.
literally older than almost anybody here.
That is crazy. I would have never guessed that at all.
Yeah.
And happy early birthday. That's really exciting. Any fun plans to celebrate your birthday?
You know, after 29, it's just not as fun anymore. Although this is my
Yeah.
29th birthday, just for the 13th, 14th year in a row. So that
Yep.
being said, I don't know. I just like kind of take it as it comes, and I'll
Yeah.
probably get out. The weather is beautiful here, so I'll probably go do something. But no, nothing solid.
Yeah. Where do you live at?
I live right now in Virginia Beach, Virginia.
Okay. That sounds amazing. I've never been up there, but sounds beautiful. Last rapid fire question is, what is a non-medical skill or a hobby that you feel like makes you better as a nurse practitioner?
Hmm. A skill. So it's communication skills, but I don't mean like everybody has communication skills. Well,
Hmm.
most people in medical profession, but I must have that face. And this is unusual. People with tattoos, right?
Hmm.
Most people with tattoos are kind of like, or at least used to be viewed as unapproachable.
Hmm.
I can't tell you, I am out in public and everybody wants to tell me their life story. So it must be the
Wow.
face and then like the communication skills because I've never met a stranger, and it's not because I initiate it. So I'm just gonna say that that definitely helps with all aspects of medical care is being able to talk to people, especially when you may be when someone first gets on me. Maybe if they're not used to somebody with a lot of tattoos, they're like, "Oh, I don't know. How is this person gonna be?" So just
Hmm.
like quickly putting them at ease. I don't know. I think it's a skill. We're gonna say it counts.
Yeah, no, I love that. That's so true. And it's amazing that people are able to be comfortable with you and feel like they're not going to be judged. So thank you for that. Um, Now we'll jump into, I just want to hear about you, your background, just a quick introduction to who you are.
Oh, anything quick is hard. Okay,
It
so
doesn't have to be quick. You could go on for as long as you want.
here you go. So I'm a nurse practitioner, which for those of people who don't really understand the difference between a nurse practitioner and a nurse, I was a nurse. I've been a nurse for ooh, almost 18 years now. So I started out as a nurse and I worked in cardiothoracic ICU and then went on to get my master's to become a professor. So I was a professor at a tier one university in Texas for several years. And then I just decided that I wanted more than just the bedside. I wanted to actually be over patient care instead of just participating in it because both jobs are super important. So then I went back to school and I got a postmaster's degree to become a family nurse practitioner. So I can do all kinds of medicine and do across the scope. But Got into virtual medicine in 2000. And by the way, I've been a nurse practitioner since 2016, so
Okay.
closing in on almost a 10-year gap here.
Yeah.
Um, got into virtual healthcare before the pandemic. So before it was cool to do virtual healthcare, and I worked at a company that's now sadly no longer working, but it provided contraception access, which was just
Mm.
so important. And then since then, I've really made a career out of working with virtual companies to help expand access to care wherever you are. So I firmly believe that whether you're in the middle of New York City or you live in between two cornfields in
Mm-hmm.
Nebraska, you should be able to access the same quality of care. And what we found is that telemedicine has really expanded that region. It's really important, and I hope that whatever, as administrations change and rules and things, that we never lose that access that we gained during the pandemic, because it's really changed lives with the ability to access things. So man, I just like totally veered out of like about me, but that's just the way that's like what I tie. So I'm a mom of four.
Mm-hmm.
They're all older. So work is, now I'm an ATM and a chauffeur, and if I'm not doing one of those things, I'm working, because that truly is like my passion in life, other than being a mom. Like that's what I feel
Yeah.
like I was put here to do. So
Oh, that's awesome. Well, thank you for that background. And I completely agree about the healthcare. My in-laws live in rural Iowa, and it's crazy that like the big hospitals are like 2 hours from them. And so I think that virtual care is just so important. And I was also a nurse, ended up working in the telehealth space, and I'm just so passionate about expanding this care. And so going back to, your career starting as a nurse, what were some of your first experiences in nursing, and how do you feel like they've shaped you into the clinician that you are now?
yeah, so we have to go back a little further than that. Actually, the very first job that I had was when I was 18 years old. I worked in a state mental health institution, and there were acute psychiatric cases, and then there were patients that were what we used to call not guilty by reason of insanity. So they were long term, some people have been there 20 years. So when you start that kind of job when you're 18 years old, therapeutic communication becomes pretty important, and also not judging people, because there were things
Hmm.
that people had done, in the throes of the worst part of their mental conditions that regular society might not understand or be able to contemplate how you can therapeutically react with that person. But as that went on, and here's another fun fact, like I was actually very afraid of blood. I didn't think I
Mm,
could go to nursing school. I thought I was going to become a psychologist.
yeah.
And I had a very close mentor that was a nurse that said, just fake it till you make it. You can get through that, and then you can go into you can come back and work here as a nurse. You'll never have to see blood. It'll be fine. Well, I went to school, and I found out that blood actually doesn't bother me. I just need to be desensitized to it. So
Hmm.
cardiology was a really big passion of mine. That's what I started out doing. And here's the thing, a lot of cardiology is not actually issues with cardiology. A lot of it is anxiety, and people, they get the
Mm-hmm.
palpitations and the sweating, and they think they're having a heart attack. So I was having to do probably 30% mental health care, which I was already familiar with from having worked in it for so long, and then the rest of it was tied in, and then that flows into metabolic health, and then the medications can affect that. So it's just so interesting about how, if you think about it, traditionally we've kind of split into the physical and the mental side of things, but the truth
Mm-hmm.
is they're so closely intertwined. And that's one of the things that I'm so excited about with Clinic, is that number one, not only do we have medical leadership that recognizes it, but two, we're putting things in place that are coming up where we're going to be able to integrate a more holistic, integrated access to care. Now, of course, there are some things that I can't do right now in person, where I can't feel and poke and
Mm-hmm.
touch, that traditional stuff. But the really cool thing is, a lot of innovations came about because of the pandemic, where there are more remote monitoring and things where we can transmit. So I really think we're on the verge of a new era, where some of the things you used to think, well, I have to go in the office for this, it's not always going to be that way. And the next 10 years are going to be super exciting in terms of where we can go, as far as how much do you actually have to leave your house to get care if it's not like acute. Of course, chest pain, shortness of breath, gotta go get evaluated, etc. But we're just on like the cusp of something that's super interesting right now. Um, it's just going to get better and better, but I'm in the middle of my career right now, so I'm excited
Yeah.
to see what that looks like as I'm moving towards the end of my career and helping usher in like the next wave of younger clinicians where they won't ever know kind of what it was like in the early days of telemedicine when it wasn't really recognized as legitimate.
Yeah, absolutely. And I'm curious, do you have a lot of patients who say that they maybe seek out telemedicine because being in a doctor's office makes them feel uncomfortable or scared? I feel like that's something I've heard from a lot of
Yeah,
patients.
absolutely, absolutely. The other big thing is when you think about traditional doctor's office or nurse practitioner or PA or whatever, a lot of times you think about the lab coat. Now, sometimes I'll wear a lab coat,
Hmm.
very buttoned up, very professional, and that can be really intimidating to someone, especially somebody who has substance use or maybe they've been involved in the legal system and they come in feeling judged. And one of the biggest things is, of course, this is not why I got tattoos. I got tattoos
Hmm.
for personal preference, but I love the fact that I feel like patients relate and feel comfortable with me automatically because I could also just as easily be sitting beside them at a meeting or you know what I mean. So
Hmm.
um, I think that there's that, and then there's also this. There's just a more relaxed feeling of I'm in my office. You can kind of see what my space looks like. Um, there's a little less clinical edge to it. Now, I'm still giving clinical care. I'm still talking about things, and patients do say that. Like, I didn't know about you at first. The tattoos, I wasn't sure, and then you started talking to me, and I understood. Like, yeah, you absolutely know what's going on, and I felt really comfortable being able to talk to you. So, that's such an important thing. And to be clear, not every provider at clinic looks like me, right? We've got
Yeah.
people all ranges of ages and ethnicities and buttoned up or whatever you prefer.
Hmm.
But the really cool thing is that the rapport with a patient, there's just a variety of people, and they're looking to give you good care. And especially in an area that we work in primarily that can be really stigmatized, that is
Yes.
something I'm pretty confident is like I like to call myself the OG provider because I've been here since the doors opened at Clinic.
Yeah.
I can guarantee that that's not something that any of our Clinic Medical providers are ever going to get a complaint on that a patient felt stigmatized because of the care that they received. Where unfortunately, I cannot say that about some of the peers that are still working in the space that are very much of that old mindset prior to harm reduction. It used to be, even when I first trained to it, the idea wasn't about harm reduction. It was that if your screen was dirty, and we don't use that
Yeah.
word anymore, and anybody that uses that word is really practicing in an old way. Um, those are the people that need more care. Let's enfold you more because something is not going right with the treatment plan. It's not your personal failure that you had a use of some substance. It's that we haven't really connected on what are the goals, what are the supports I need to give you to get you to where you want to be in your recovery goals. So recovery looks different for everyone. I think that's super important that we acknowledge that with patients and that we have clinicians that understand that as well.
Yeah, absolutely. That is so important. And I love how you said it's like kind of a failure of the treatment plan. Like, where can we support you better? And on the topic of, addiction medicine recovery, I'd love to hear how you even got into working in the addiction space.
So this is kind of a personal one, and I'll share it because I think it's important. So number one, a lot of families have a history of addiction in them, and my family is no exception. Most people in the United States, unfortunately, are related to or know somebody that's life is really impacted and impacts the whole family. So there was
Yes,
already that.
myself included. So I totally get it.
Yeah. And the other part of that is the medical community. I mean, you wouldn't believe how many nurses, physicians, etc., actually have substance use issues. We have a high
Yes.
stress job. There's a lot of trauma involved, and there's not really a place to unload about. It's getting better, but traditionally, you didn't have a place to decompress. Something bad happened with a patient, you got to suck it up and go into the next room. But all of that access, etc. We're getting better about offering those programs, but my best friend actually succumbed to opioid overuse disorder while I was still in nursing school. So I still hadn't, I was actually my first year in nursing school. She was already a nurse. And it was before we called it an overdose. Her cause of death is actually respiratory depression, but it was caused because she had unfortunately become dependent on morphine, and she had just taken too much, and unfortunately she wasn't found until the next morning. So that realization that, because obviously she and I used to hang out a lot, and that when you're younger, of course, I'm not going to say I've never had a drink, right? At
Hmm.
21, of course, no, that's something that's not part of my life now, but saying that in the past, that's somebody that I had gone out with, and it struck home to me that if this brilliant nurse that like inspired me and like helped mentor me could succumb to this, it was not there's this misconception that it's a personal failing or etc. And I think that's really a leftover from the 80s war on drugs, and we were all kind of, if you're old enough to be from that era, it was baked into you, right? That these misconceptions that now we know aren't true. But just number one, in her honor, but number two, the only reason I'm on this side of the screen and not the other is just because of a series of choices that were made in life, or genetics, or other factors, because it could very well be any of us that are sitting here
Hmm.
today that are lucky enough to not have a substance use disorder, that life could have gone a different way, with just a few different changes in our trajectories, if that makes sense.
Yeah, absolutely. Well, thank you for sharing. I'm so sorry for your loss, but I think that I've heard from a lot of providers. I feel like it makes a better provider out of you when you understand and you know someone who's gone through it, because you're just so much less likely to judge other people, and you just understand that nobody wakes up and says, I want to be an addict. Something transpired to make
Absolutely.
that
That's
happen.
exactly what I tell people when I teach this, because I teach this as well.
Hmm.
Nobody woke up and said, "Hey, I think I'll go get addicted to heroin today." There was
Yeah,
some a factor that happened. And in a lot of cases, it was unfortunately the medical community. And now, to defend the medical community, we didn't know what we didn't know. Back in the days when
exactly.
those reps were telling us, they were telling us that opioids were safe, and you know we gave them in good faith. And then by the time you realized what was happening, like, unfortunately this snowball effect had happened. But um, I just think that it's really important. And then also, I'll say this too: I suffer from anxiety, and anxiety cannot be reasoned with. I can
Yes.
treat it all day long, um, but having had providers before that have never had anxiety, clearly have never had anxiety, and kind of given me routine advice, etc., there is something about being treated with by a person that understands, because they either know someone with a condition or they've had it themselves, that gives you an extra sense of, now my medicine regimen for my anxiety might not be what is the best for my patients, but me just having understood, it doesn't make you feel better day one, and being able to like explain that process and say, yeah, I absolutely can empathize with what you're going through because I've been there myself. um, I think that that's great. Now, that doesn't mean that I have to have every single condition somebody sees me for, but just having
Yeah.
that empathy of having even gone through the medical system and felt like I wasn't being listened to, I really try to make sure that my patients feel like I am listening. And even if I can't 100% relate on, oh, yes, that's happened to me as well, that I'm giving them my full attention and not just writing it off as oh, that can't be, or that's not the way it is, or that's not what the textbook says. Because unfortunately, our bodies never read textbooks, and they don't always do what the textbook says that they do.
Yeah, I completely agree. And I'm sure it's both rewarding and challenging to work in the addiction space. I'd love to hear kind of the highs and the lows that you find working in the space.
Yeah, absolutely. So, this is one of my favorite areas of medicine to work in, because it can be challenging. And sometimes you have patients that come in and they're not really there because they want to be there at first. They're there because the court systems or because the family has laid down, like, this is the way it has to be. And that can be challenging because really recovery has to be fueled internally. And the goal with that kind of case is that I help you see the value for yourself in recovery and how things are starting to improve, and you start to want that for you. Otherwise, it's going to be a rocky journey, or maybe like a journey that you're not quite ready to fully commit to, and we've got more ups and downs. But that being said, this is that field where you see people get jobs again, and they get out of their legal issues, they get their kids back, they restore relationships. That's all really positive, and that makes the bad days worth it, because I can't tell you how many patients I've just seen their lives like absolutely turn around, especially because I work with a lot of patients that are pregnant in the postpartum, space, and that's an absolute love for me, because a lot of your family or etc. may try to shame them for using Suboxone, where we've known for many, many years that using medication-assisted treatment during pregnancy is absolutely the way to go. I mean, all of the major, even the American College of Gynecology agrees with that. So not just the American Society of Addiction Medicine. On the other hand, of course, nobody likes to talk about this, but it's important to acknowledge it. I've lost patients along the way. I've attended funerals, and unfortunately it happens sometimes, and you have to just do the best that you can with educating people and harm reduction, and really enfolding them and recognizing clinical changes. But it's just one of those things that does come part and parcel with any kind of medical field, that sometimes there are bad experiences, and being able to learn what you can and keep going. And also self-care. Like, self-care is super important.
Yes.
It's hard to lose a patient, or even if you don't lose that patient to forever, right? There's the hope. This is the biggest thing. Sometimes people drop out of care, and it's maybe because they weren't fully in it, or life circumstances change, or they're just not ready yet. You always told me, come back. As soon as you're ready, come back. We get you started again. No harm, no foul, no judgment. And you just hope that they come back to you, or they go to somebody else when they're ready for that journey to be their journey.
Yeah, I'm glad you mentioned self-care, because that was going to be my next question, was kind of how do you manage the hard days? What do you do to kind of step away?
Yeah. My kids are something that I definitely like. We game a lot, so
Okay.
sometimes me yelling on Call of Duty is very therapeutic.
Yeah.
Also living near the beach, and we've got a bunch of great parks and trails here. Like, I try to get outside and get sunshine. I know it doesn't look like it, but I do absolutely get sunshine. I just use my sunscreen so that I can continue to turn 29 year after year.
Yep.
But those things, and then just taking time for little moments. Like, I tell this to my patients, you sometimes just changing your sheets, and for my ladies, shaving your legs before getting in bed at night, and getting fresh sheets with like your shaved legs. Like, there's the little things in life. It doesn't mean that you have to spend a lot of money or something. Taking 15 minutes to write in a journal, or do some stretching, like, all of those are self-care activities. So there are free ones, there are ones that cost money. Of course, I like ones that cost money too. I like perfumes, but there's just a balance, and you pick that day what you've got time to do, and put in that space, and what fills you up, and finding things that refill your cup are like the biggest thing. And having supportive colleagues really helps. Clinic, even though we work remotely, we really have a tight-knit team, and we have a lot of team meetings where people can come in and get support as well. So there's that all. You've got to have the support around you, the internal support, and things that you can do when you're alone and you don't feel like sharing that with somebody. And then also having a network of support with your colleagues is also important as well. So
Yeah, I love that. I think something as simple as putting on a candle, taking like a full everything shower, washing your hair, doing all the things, getting in bed early, like just those little things, taking care of yourself is so important. And like you said, it doesn't have to be expensive. It can be super simple, and just doing the things that you know you need to do to feel good the next day.
100%. And this is not bad advice for anybody, but I tell my patients this: get yourself a journal, or if you're like an electronic person, in your phone, open up Notepad and list out 10 or 15 things that are self-care activities. And when you can't, just like I tell this with my kids when they're bored too, I used to make them have, when they were younger, a list of things they could do. And I'm like, okay, look on the list. There's something on that list of 10 or 15 things that you can do that's going to help with the boredom. There's 10 or, there's something on that list of 10 or 15 things of self-care that you can squeeze in today to help bring everything down to a more tolerable level.
Yeah, that's such a good practical tip. I love that. And I love to hear, how did you even get connected with Clinic? How did your journey with Clinic start?
Yeah, so um, my name, I've been doing this for so long, so
Hmm.
my name gets circulated a little bit in the telemedicine community. Anybody that's been doing this probably longer than 5 years has probably either worked with me at some point or met me or knows me through a colleague. So like,
Yeah.
but our um, Dr. Asani, who
Hmm.
is our chief medical officer. He and I have been working together at different places for many years. So when the
Okay.
company started, he's like, I know somebody, and told, Avish, our CEO, that like, I'd really like you to meet this person. She's been working in telemedicine for a long time, and that's how I got brought in. So connections, super important, and it's been great to build that synergy and kind of work with someone who you already have that relationship with. But then I'd never met Avish or Lacey or a lot of our other core team, but now
Hmm.
I've been here again. I couldn't even tell. I'd have to think back and count the years, but for quite a while now. And it feels like kind of way like I've always been together. It's a family, especially when you go from like that startup mode, like from patient
Yes.
zero to now where we've expanded into so many states, and now we're doing so many extra things and more things to come. Um, yeah, so that's how I got started at the clinic, and that's like why I say there was another nurse practitioner that started at the same time. So that's no longer with us, unfortunately, great
Hmm.
provider, but that's why, like, I'm one of the OG people that was here, and so
Yeah,
it's just, I
that's
know all
really
the, like, the
exciting.
back history, right, like, of how it's evolved, and it's, like, been a super exciting process to watch everything evolve.
Yeah, I agree. Even over the last like year and a half that I've been here, it's been so cool to see everything grow from not being operating in any states for clinic managed to now being operating in 8 states. It's been so cool to watch it grow.
Yeah.
And I would love to hear, like, you said you've been in different spaces in the telehealth realm. What stands out to you about Clinic that's different from maybe other telehealth companies that you've worked at?
Well, I mean, I don't want to give too much away, so I got to be
Yeah.
careful about that. But I will say that we have bigger plans than just one service. So you can see that already happening, right? So,
Hmm.
um, like I said, access to care, and that's as you see the evolution of clinics. The clinic has its eye on something bigger, but also at other places that I've worked, sometimes as you grow bigger, the eye of the mission, the eye drifts from the mission, and it
Yes.
becomes all operationalized, and you know funding, and funding is important. You got to keep the lights on, and you got to pay people in
Yeah.
order to expand. But that being said, at the core, we wouldn't exist without the patients, and the
Hmm.
patients need providers. So clinic does a great job of making sure that we are balancing growth and the operations side, and what the website looks like, and etc., with making sure that we are staying true to that mission to caring for patients, and that we're doing it in a way that is sustainable so that we can keep those patients in care and keep them with providers, and also in a way that's quality, because there are a lot of telemedicine companies now, and I have utilized some of
Hmm.
them over the years for different things to see what's the care like, and I feel like I'm a pretty good judge at this point. And there's some places where, yeah, let's give them kudos. They do excellent care with the thing that they do, and most of them specialize in one or two things. And then there are some places where you know that you are just a number in a queue and there is no real, it's almost like a cattle chute, and you're going through and you're getting in the box care that everyone else gets the same thing. So that would be one of the biggest differences, is we are really focusing hard. And what I love is the operations team asks me my opinion as a provider and as somebody
Mhm.
who's seen a lot of other places, how it's done and etc. Um, is this the way that you would do it? Do you think we could do it better? What are your thoughts on this process? And I can tell you from some of the other companies I've worked with, sometimes the medical part is an afterthought, and that makes it a little bit harder to feel good about what you're doing at the end of the day. That's not the way I feel here at all.
Yeah, and you have to listen to your providers as the ones on the front line day in and day out with the patients. And so that's the number one person you should go to and say, what's working, what's not working. So I love that you feel that way here.
You can't understand the patient journey if you're not part of the patient journey. And now I will say this too, like from the provider side, I don't always understand what it takes to get a website page up. To me, it's like
Yes.
you just slap it up, like you just put
Yeah.
content on, and like, what's the
Yeah.
problem? I can make a Squarespace space page in a day. What?
Yeah.
So there's that balance of talking, and that's like what I love. I get to work with operations and the people that design the web pages and be like, oh, okay, I'm sorry, I did not understand. Just like I can't
Hmm.
expect you to understand how to prescribe a medicine, right? I
Hmm.
can't understand what it's like to write that code. So just working together, it's like super interesting. I feel like um, that is just such a key thing, is like that synergy between the departments. So
Yeah, absolutely. I'm glad we have experts in all areas here because I could not imagine doing like credentialing day to day or billing. That stuff's so far over my head. So I'm glad that we have like the best of the best in every single field here.
for sure. And there is another i- we work with another nurse, and I'm not sure if she's been on. I don't know if Jen's been on, but
Mm-mm, not yet.
Jen is so great at some of the things that I do not enjoy doing, right? Like,
Yeah.
I do not enjoy chasing down the legal team to ensure that our forms have every little checkbox. I'm much more
Hmm.
interested in figuring out what questions can we ask beforehand to make sure that that patient's got to answer less questions when they're, live, when they're
Hmm.
feeling poorly or something like that. So it's so important to work with people that have those different strengths. And like Jen's one of my favorite people to work with, just because we play well off of each other's, like, there's some things I love to do she does not love to do. So that's a great working relationship when you've got that, where um, you can say, you know what, this is your strength, and then I'm going to go over and do this part, and then let's meet in the middle and make sure that we've got it all stitched up. So
Yeah, I love that. And what would you say to maybe a nurse practitioner or a physician or PA who's considering maybe working with Clinic?
yeah, absolutely. Come, come on. If you've got questions and you want to know the real tea, as it were, ask to set up a meeting with me. I'm 100% open to talking about the experience and answering questions, because I have worked as a contractor at a lot of telemedicine companies, good and bad, and can absolutely speak to the experience of how this is different. And
Hmm.
you really feel like you've got a fair amount of autonomy. There's always certain rules that you have in any place, that you got to follow, just because that's what the medical director and the chief medical officer have put in place in medical leadership. But um, there's a good amount of autonomy, but it's balanced with support. We have one of the best support teams. Our care coordination team is, I can't even talk highly enough about them. So I just feel like this is a space that if you've ever worked somewhere and you feel like you've worked in a silo and you don't have anywhere where to go for questions, etc., we are not like that. We have so many clinical webinars where people can attend about different parts of the process, and I myself host one once a month where we go in and we talk about things, and then individual sessions. And it's not just me, it's the team who helps you with passwords and with technical knowledge, and meeting with the CEO. And that's just very rare. A lot of times in other companies, there's one all hands. It's once a month. You sit there. You may have like a 5-minute Q&A where you get to ask a question, and you're nervous about asking the question because the entire group. It's just so much more intimate here, and you feel so much more comfortable asking things. And yeah, so come if you're interested. Come talk to us. And even if you're not 100% sure that the specialties we offer now are something that you're fully an expert in, we've got trainings. We have absolutely got space where if you're interested in something and you're willing to learn, like I'm 100% on board with facilitating increasing your knowledge so that you feel really comfortable. And like I'll use the example of pregnant patients. There are a lot of people who are not comfortable with patients in that pregnancy or postpartum period. I will absolutely sit down with you and talk through like the experience that I've got, and how you treat those patients, and show you the guidelines, and just help build that comfort so that you can expand that outreach, because I think that that's one of our most vulnerable populations, and we should definitely make sure that as many providers as possible feel really comfortable providing that care.
Yeah, that's amazing. And that's awesome that you're there to just provide that support for other providers, because people want to learn from someone who's been in those shoes. So that's great. And something you pointed out that I really liked was that, our CEO is involved, which I think is so important. At so many companies, the CEO is so far removed, which obviously companies grow. But I love that our CEO here is in the mission still, day to day, on the meetings. I think that that's so important because he can see what's happening, what's going wrong, what can we fix. And he's so passionate about this mission, which is really important.
Absolutely. I mean, there have been very few companies where I can directly message the CEO and have his
Yes,
cell phone number, and I've never felt like I could not pick up the phone and call him and say, I need to talk to you about this. And that
absolutely.
is major, to be able to have that kind of access. And same thing to our chief medical officer and our medical director. Like both of them, their
Hmm.
numbers are in my phone. So when I've got to, like, we need to deal with this right now, I've got that ability. And so thankful for it, because it is not always like that at other places.
Yeah, that's so comforting to have that support. I know that you said you've mentored new nurse practitioners, new grads. What is some advice that you would give to new nurse practitioners in general, or ones wanting to maybe jump into the addiction space?
Yeah, absolutely. And whether you're new or you've been doing it for 10 years, something else, and this is going to be new to you, it doesn't matter if this is your primary focus, right? When they got rid of the DEAX number waiver,
Hmm.
and we really said that everybody should be providing Suboxone, this is something that no matter where you work, you should feel comfortable treating. And I think that it's an important skill. And I'll use the example of delivering babies. Now, have I delivered a baby? Yes, several, because I was made to in school, not because it was
Yeah.
my interest. Like, thank goodness there are people that love to deliver babies. This is not one of those types of medicine. Just like you need to be able to recognize a heart attack that's
Hmm.
occurring, and that you need to get that, you might not be able to do the cardiac catheterization or whatever, but you need to recognize that that's occurring and get 911 and get the patient to that level of care that they need. Opioid use disorder, something we need to be able to know what questions to ask to identify it, and then you need to know how to initiate the treatment, and then if you're not able to in your setting continue the treatment, get them to where they need to be. So that's the biggest piece of advice I have is, don't be afraid of it. Don't say, oh, it'll never come to me. It will. This affects of people of all walks of life, of all socioeconomic statuses, ages. Again, you can encounter them even if you are a midwife or a women's health nurse practitioner, and you're just going to be working in an OBGYN office. You will see those patients that need this kind of care. So please educate yourself on it. If you're still not comfortable with it, find a mentor, whether that's coming to work with Klinic and working with me, and etc., or somewhere else. There are lots of really good training opportunities out there that aren't quite as, the DEA used to make you go through this really long training, and it was very, how do I say, It was very much theoretical. It didn't give you
Mm.
really, I came out of that course after all those hours and I thought, I still am not quite sure how I implement this. Like, and thank goodness somebody who was very experienced took me under their wing and was like, this is how we do it in real life. Yes, it follows along with that, but this is how you actually take what you learned in those many hours of training you actually apply in real life. But we've gotten better trainings now that are out there that a lot of them are free and you can access them and um, just get educated on it and don't be afraid to treat it. Please treat it because it may be the difference between you ever seeing that patient again or not. So
Oh, that's so important. Last question. If listeners remember anything, just one thing from this episode, what would you want them to take away?
if you or someone that you know or love is possibly, even potentially, suffering from an opioid use disorder, please encourage them to get treatment, or you yourself come and get treatment. Just talk to somebody. Just because you come and talk to me doesn't mean you're locked in and you have to get care. I'm not going to mud wrestle you to make you take Suboxone, but let's talk about the options. Let's talk about the goals. Let's talk about what treatment looks like because it may be very different than what you think. I'm going to say this, and harm reduction does not always mean that somebody gives up all substances. Now, the
Hmm.
goal is that, for me, is that eventually somebody sees the benefit in living a substance free life. But that being said, the most important thing at the end of the day is the most dangerous threat out there right now is opioids. And if we can get somebody to have access to Narcan and treatments that are going to help them to not use opioids or to reduce the frequency, and then they're using harm reduction like never use alone, etc., that will
Hmm.
make an impact in the statistical likelihood of an outcome like an overdose or a fatality go down dramatically. So if there's even a question, if you're not sure, come get an evaluation and talk to an expert, find out the facts. And if you're a loved one, it can be frustrating because you can't force somebody to, but all you can do is, help provide them with the resources, encourage them, and keep having that conversation with them until they're willing. Now, being careful not to nag because nagging sometimes
Hmm.
pushes people the other way, but just giving that, again, that therapeutic communication. I'm concerned about you. Would you please consider getting evaluated? So nothing else we talked about, none of the fun things,
Hmm.
etc., come through. It's that there's hope. There are places that are not going to give you that stigma that maybe you felt before. We are not going to make you feel guilty. We're going to help alleviate that guilt and reinforce that this was not a personal shortcoming of yours. Um, if not clinic, somewhere else, but clinic, I just know that our providers are in a unique space where we do that harm reduction care, and our whole ethos is about, you know, this is not a shortcoming. We are here to treat, we're not here to judge. So I hope that is what anybody listening to this takes away.